Turkey today is uniquely positioned to offer excellent medical value to patients from every corner of the globe. The concept of medical tourism in Turkey blends the country's worldwide reputation for high-quality physicians, advanced surgical treatments, precise diagnostics, attractive pricing, luxurious 5-star hospitals, quick response time and beautiful holidays. Turkey's academic and teaching institutions are universally recognized for their high levels of achievement and for the exemplary training of its doctors. Turkish doctors evidence high visibility in the international arena, as lecturers at medical schools and hospitals, as visiting experts or presenting papers at international conferences. Turkey is distinguished by institutions of research and higher learning that have achieved global acclaim. Researchers in these laboratories have developed many inventions to help fight diseases and illnesses. The use of modern technologies, techniques and devices minimizes both the duration of the surgery and the recovery period, adding to the patient's quality of life. Turkey has an expanding network of ultra-modern hospitals and medical centers that are either privately financed or state-owned. Well-staffed and fully equipped, these facilities are highly efficient and among the most advanced in the world. They have the capabilities to respond to the complex needs of modern medicine, from initial diagnosis, hospitalization, post-operative intensive care and physiotherapy, through to patient rehabilitation. Turkey offers world-class medical professionals and healthcare solutions for less than any comparable environment, with almost no waiting time. Turkey's medical expertise and institutions provides excellent healthcare cost value with up to 60% price advantage compared to those of the USA and Europe. Patients doesn't have to compromise on price or quality, they can get both in Turkey. Hosting over 1 million visitors for medical tourism in 2019, Turkey possesses a plethora of qualities and inherent advantages and ranks among the top 10 source countries in medical and health tourism. Setting out plan to become major global medical tourism hub in 2020, Turkey's ultimate aim is to promote innovation and ensure international patient access to highest quality treatment.
Hello everyone, thank you for joining us tonight. Can you be a surgeon and have a fulfilling life? Well, it depends on how you define rich and fulfilling. For many surgeons, fulfillment is measured by the satisfaction of making a difference in someone's life. Today, one of them is our very special guest, General Surgeon, Assistant Professor, Dr. Ebru Soy. Welcome, Doctor.
Good evening, everyone. Thank you.
You're welcome. Felicia is with me. She is the Africa Regional Council of International Health Tourism Association. Together, we will talk about surgeries, transplantation, and also how Dr. Soy manages her successful career, keeping her work-life balance. First of all, Doctor, a huge thank you for joining us.
Thank you.
Can you tell us about yourself?
It's an honor to be here. We met Felicia for the first time 1 hour ago or something like that, and she asked me whether I graduated from USA or, and she asked where did I graduate. I graduated in Turkey, and Turkey is a leading country in education, not in only medicine, but in many fields. I graduated my high school, my college, my university, all in Turkey, and I am honored with this. I am 40 years old. I'm assistant professor in general surgery. I work in transplant. I work as a transplant surgeon. I do liver and kidney transplants. And I work in the first announced Department of Transplantation in Turkey. Here in our university, we are the first unit that is announced officially as a department. I work with my mentor, Dr. Haberal. He is very also famous in world in the transplantation field. I can summarize myself like that.
Thank you. What is a general surgeon, doctor? It's a very, very hard job.
Yes,
So
yes,
what
it's
it
a very
is?
hard job. The content is actually in the name of the specialty, general surgeon. And it is a really wide surgical specialty. I always tell my students that the general surgeon cares about the area in the human body from chin to the groin, actually, neck, thyroid and parathyroid diseases, breast diseases, and general surgery focuses on the abdominal content, esophagus, stomach, intestines, liver, spleen, and the diseases of the abdominal wall. All these areas are the areas that general surgery focuses on. We are dealing with all these jobs. It's a wide specialty. So it has some branches, like I work in transplantation department. It has endocrine surgery, it has breast surgery, it has oncological surgery, it has many branches in it. And it's a wide surgical specialty.
Doctor, how long does an organ transplant surgery take? How long?
Organ transplant surgery.
How long does it take?
It depends on the organ. The transplantation means a replacement of an organ from someone to someone due to the organ failure. We can transplant organs and also tissues. Transplantation means all the replacement of these organs and tissues. It depends on the organs, actually. I am specialized on liver and kidney transplantation. Liver transplantation takes much more time than kidney transplantation. We can do kidney and liver transplantation from both deceased donors and living donors. When we do the transplantation from a living donor, then we go to the operation in two separate rooms. One, we procure the organ from a living donor. In the second one, we do the recipient. Kidney is much more shorter. Liver is much more complex than kidney, actually. Sometimes liver transplantation takes 8 or 9 hours. Sometimes it spends 12 hours. Kidney spends like 3 or 4 hours, not much more than that.
But requires stamina from doctors, right?
A lot.
Yes.
Especially when you're a woman.
Surgery requires stamina from doctors, actually. Not a physical strength, but also a mental strength is needed.
Exactly.
You must have a real patience. You must be really patient during surgery, and you must see 10 steps after you. What are you doing from? You must plan at that moment. You must be a problem solver all the time. Yes, all the time. A problem solver and a problem dealer, and it needs great patience, actually, more than a physical strength. And when you're in surgery, you just stop thinking about your physical exhaustion, actually. You are all concentrated on the patient. You must solve all the problems that will be coming towards you.
So how do doctors decide who gets an organ transplant? I mean, the matching criteria and so on.
Yes. We do transplantation for end-stage organ failures for kidney and liver. End-stage kidney disease have another solution than the organ transplant, actually. We have another tool, hemodialysis. Patients took hemodialysis 2 or 3 times a week, and they can postpone this disease for a time. But hemodialysis itself has its own complication, unfortunately. Yes, they live, but they cannot live like us. They can live like a normal person. They need transplantation. And in textbooks, it is written that transplantation is the gold standard treatment of end-stage organ failure. And in case of liver, we don't have no choice. Liver transplantation is the only treatment and the gold standard treatment for these people to have a normal life and to have a life, actually. To have a life. So we do transplantation with people with organ failures, actually, for liver and kidney.
Doctor, is it true that solid organ transplant recipients have higher risk for COVID-19?
Actually, we will see this. I think, in my opinion, for COVID-19, the most important thing is the protection. And I see in these 6 months periods of pandemic that these people, the transplanted ones, are very careful about their protection. So if you protect yourself, then you will not have COVID-19. And it is true for also transplanted ones. Yes, we make their immunological parameters more suppressed. They use immunosuppressive drugs. And a virus or a bacteria makes you just a flu or influenza, but they have pneumonia. Their system is much more weaker than us, but they protect themselves much more than us. So I saw no difference between the transplanted ones and the normal ones, actually, in this 6 months of periods. In the 6 months of periods, we continue doing transplantations also. When you take care, you will not have problem. And I don't think that they have higher risk for COVID-19. Yes, they are higher risks for infections, higher than any of us. But if they protect themselves, they will have just a normal life. Yes.
Okay, doctor, how long does recovery take after organ transplant? How long?
In children, it becomes like a miracle. You take I must tell you like this, you take a greenish and yellowish and malnourished child to an operation, and if everything goes okay, we discharge him or her after 7th day of the operation. And when you see in the first follow-up, you can recognize the child. You can recognize the child. They grow faster. We like flowers. And it is the most satisfying moment in our lives. You see that they become normal. They grow much more faster than normal. Yes. The recovery is a miracle. And also for elder ones, the skin color changes in both kidney and liver. Maybe you don't notice till now. The kidney patients have a little bit darker skin. It becomes paler, and they become normal persons, and you can't even recognize them on the street. You can't differentiate it from the normal ones. The recovery is very, very fast if everything goes okay. The procedure is very complex, but if everything goes okay, the recovery is really faster. Yes.
What is the survival rate, doctor?
For transplantation, the experience is the most important thing for the survival of both the patient and the graft. For graft survival, you have some special parameters like mechanical problems about the graft and the immunologic parameters. The recipient can reject the organ, actually. And so it is these all same for the recipient. The experience is very, very important, and this is not the transplantation is not just a thing just general surgeons deal with it. It should be a multidisciplinary approach. You need an immunologist, you need an nephrologist, you need an hepatologist, you need an interventional radiologist. It's a teamwork. When these teams are powerful, then the survival becomes like more than 90% or something like that. So it depends from center to center. Now here in our center, we performed more than 3,000 kidney transplants and more like 700 liver transplants. And we have patients survived more than 25 years.
Wow.
The new liver, yes.
Wow.
Actually, in our university, they are working. These people are working, and we are working with them. And as I said before, you can differentiate it from normal ones. So team is important. You must be an experienced team for that. As I said before, my mentor is one of the leaders, and actually he is the pioneer of transplantation in Turkey, and we are so experienced. So our survival rates are much more higher than many centers. It depends on the center.
Okay. Doctor, how key is it to get your patient medical review and second opinion before the patient arrives in Turkey?
It is very important. We always say that there isn't illness, there is the patient. There aren't rules in medicine and also in surgery. And the condition of the patient, the medical status of the patient is very, very important. And our approach will depend on the medical status of the patient, actually. So it is very important to have the medical review and the second review before the patient arrives in Turkey, because and it should be in detail. Because people can have different opinions. We might have different opinions about medical status, and these all must be told and detailed before he or she arrives in Turkey. It's very important.
Okay. Then another thing, what kind of lifestyle should a patient live after having kidney or liver surgery? What kind of lifestyle?
As I said before, they should have an immune suppression therapy for a lifelong time. In kidney, it spans for a lifetime, but in liver is different than kidney. We can decrease immunosuppressive therapies, and we can decrease them to only one drug. But in kidney, we prefer them to use immunosuppression for a lifelong time. It means that they are immunosuppressed patients for all their lives. So they must protect themselves from any infection. They must care their hygiene more careful than us. They should protect themselves much more than us.
Okay. So
I was going to ask how many liver transplants can one person have, but I think you have already answered that it is a lifetime.
Yes, right? It is a lifetime, and unfortunately, sometimes the organ is rejected, and we have some that kind of patients. We transplant and retransplant. We have retransplant patients for both kidney and liver. They can have liver transplantation if the organ is rejected. We have patients that they have rejected organs after 20 years. We do
Wow.
the transplantation, and now she or he is living for another 10 years.
Oh, that's
Follow-up
great.
is very important. When you do the transplantation, you become family with the patient.
Okay.
You become family. You know
Yeah.
him or her as you know your child.
Okay.
Because you're all together. And
Of course.
it is tabii, of course, a little bit difficult for foreign patients. We must all be in contact with them, like we do in our Turkish ones, because it is a lifelong follow-up.
So thanks to technology then.
Everything not ends with surgery.
Yeah.
Everything just starts with transplant.
Starts. Right.
So that means after the transplant, you still have communication with the patient.
Yes, all the time.
All the time.
Okay, can you tell us what are the risk factors for breast cancer?
Of course, in breast cancer, the genetic factors are playing role actually. If a woman or a man have a breast cancer in his or her family, probably he will be or she will be a breast cancer patient in a lifetime. So they should be followed up for breast cancer. And without having no child, having hormonal therapy, using oral contraceptives, they are all risk factors for breast cancer. And as I said before, it is a kind of genetic disorder. So, and the gynecological cancers and the breast cancers are all related. If in the family he or she has a gynecologic cancer or breast cancer, then the patient should be followed up for the breast cancer. The main risk factor is the genetics factors actually for breast cancer. But having no child, using hormones also increase the breast cancer risk therapy. The IVF therapy also increases the risk factor of breast cancer.
Wow.
Yes.
Okay, doctor, I want you to enlighten us more on patient management differential in terms of drugs and other treatments, especially after the initial treatment is accomplished.
Yes.
Give us a bit of what you do with the patient.
Yes, it is another problem for foreign ones actually. The lifelong treatments that should be that the patient will use for a lifelong time should be prescribed and should be gathered in their country. If we and we search for this for transplant patients, it is the main problem actually, because as I said before, they are using this therapy for a lifetime. They should have this medicine. And as I said before, we follow the patient for a lifetime. If he or she have any problem about gathering the medicine, as we will be always in contact with him or her, we will help them to gather the medicine actually. And it is also same for the other chronic illnesses. We search for the medicine that are available in their country. And, yes, in their country, and we try to help them to reach those medicine.
Okay, that's good. That's
good. Yeah, let's talk about weight loss a little. Doctor, could you tell us how a person can choose the best type of obesity surgery?
Actually, this statement is not right. The patient should not choose the way of the surgery.
Sorry. Yeah, you're right.
The doctor should choose the best way for his or her patient. And obesity, in Turkey, there's a statement that they tell the first thing starts in brain. It is true for also obesity. There are psychiatric predisposing factors for the patient to be a morbid obese. So this should be solved first of all. And obesity should be approached like transplantation. Actually, in our days, in recent days, all issues and all patients should be evaluated with a team. Obesity is something like that. They should be evaluated by a psychiatrist, by an endocrinologist, and should be followed with a nutritionist and general surgeon, of course. And the team should decide whether the patients should have benefit from the surgery. Because they are already morbid obese patients, and obesity itself is a comorbid disease, and it's already a risk factor for the surgery. And you are taking a risk by taking these patients to surgery. So you must evaluate them properly. If they can have benefits from the surgery, then we should admit the risk, the patient also admit the risk, and he or she goes to surgery. There are kinds of surgery, morbid obesity, bariatric, we call them bariatric surgery, bariatric surgery, and we choose the best one that the patient will benefit.
Mm-hmm. So what to expect after the obesity surgery? Any post-obesity surgery is needed?
Yes, probably, because this patient will lose nearly 40% or 50% of his previous weight. So the skin should be reconstructed probably after surgery, because it is the skin is not something like that you lose weight. The skin should be excised by a surgeon afterwards. He or she will probably have aesthetic surgery and reconstructions after surgery if everything goes okay. And I always believe that this bariatric surgery just give the patient a 3 or 4 years lifetime to change his or her life. The main thing is that he or she should change his lifestyle during this time. If the patient doesn't change his life, then everything comes back normal.
Yes. So what is the success rate in obesity surgery in Turkey? How can you rate?
In Turkey, the success rate is very high because we approach patients in that manner. We evaluate every detail. And if you don't believe that he or she will not change his lifestyle, then we don't do the operation. If we believe that he is ready for the operation and he is ready for changing his lifestyle, then we help him or her with this surgery. So our success rates are high.
So how long does it take to recover from an obesity surgery?
The patient discharged from hospital at 4th or the 3rd day of the operation. And we are doing this kind of operations laparoscopically. And in recent days, there are very advances in surgery, surgical techniques, and equipments. We have many tools. And laparoscopic surgeries, I think, one of the miracles of the last decades, because can you imagine opening that kind of a morbid obese patient? But by laparoscopy, we are just handling the operation with 3 or 4 just mini incisions. So the recovery is very fast. They will not have any pain after the operation. And this kind of a heart patient, it is a very hard job, can discharge from the hospital at the 3rd or the 4th day. So the recovery is fast. As one should keep in mind that laparoscopic surgery recovery is very fast, very fast. Is
it safe to get pregnant after it?
Of course, Of course, it is very safe. Yeah, we also have patients having babies, having being pregnant. We didn't have any problem. Also,
Right.
having a child is very safe after transplantation. I
Oh.
think this is much more something like that. I should be more curious because you are taking immune suppressive therapy, and as I said, they have normal lives and they can have babies.
Great.
That's really nice to know. Doctor, will I be right to say that in this your field of work, you have few ladies as surgeons?
Yes, yes. When I passed the exam for the specialty, it is written in my paper that you had the success to be in general surgery in Başkent University. I stopped like this. Will they let me do the job?
No.
Because it is going very rumors that the surgery is the main job. This is not.
Yes.
It's not a main job. I was a little bit afraid, but I saw that if you have, it needs a physical strength. It is right. It needs a physical strength, but mental strength is much more important. And I always encourage my students to be in this field. If you love medicine, if you have an more visual memory, much more than the other one, then they should choose surgery. I encourage both, mostly girls.
Oh, this is what I was going to ask you. Are you encouraging girls to have the same profession?
Yes.
Now let me ask you one funny one. What does it take to be successful and happy in your specialty?
It takes time. It takes time. It forces you to just raise one child.
Oh my word!
Just raise one child because you don't have any time. And, you must be with your child, and it just takes time. I don't see the physical exhaustion. I don't see it because it is very satisfying. As I said, you saw the baby changing in days after your operation. You cause something to change. So it works. It works. Yes.
Yeah, it is. I think one of the most exciting careers in medicine. Being a general surgeon, right? It's a privilege, really.
Yes, it is a privilege to be a general surgeon. It's a privilege to be a transplant surgeon, and it's a privilege to work with Dr. Haberal. You must meet him. You must meet him.
Okay. I will meet him. Now, doctor, how many publications do you have to your name? How many publications?
I told myself that they will ask it. They will ask me. I don't know the exact number, but I text problems, and I saw that I have already 87 publications in the
literature. Wow, that's a lot.
Yes.
So in the midst of all of this operation, you still have time to write. That is great.
Yeah.
Thank you.
Really.
That is great.
So still, what advice would you give to young women who are initiating their careers in surgery?
I will tell them that they should not give up. They should not give up. They should not give up to fight. If they love medicine, if they love surgery, they should not be afraid of it. And if they have this patience, then they will be successful. They will be successful.
Wow. So, Doctor, so far, what is your most memorable moment as a surgeon?
I mentioned it during this speech 2 or 3 times. The recovered babies, and you are showing their recovery day by day, and it is the most memorable moment in my life. Do you know, Feli, we have a children's day in Turkey, 23rd of April. Do you ever heard about it?
No.
We celebrate the Children's Day in 23rd of April in Turkey. It is a national celebration, actually. It is celebrated in whole the country. And also we do organizations for our children, transplanted children, for that day. And they come that day. We come together, we have fun together, and each year we saw all of them all together. And
Wow.
Each year we saw, oh, you can't be him, you can't be her. Is it her?
It's different.
He was green. He was
Yeah.
yes. When you saw that, they will just going to die if they don't have this operation.
Absolutely.
But
Yeah.
now they are dancing
Different.
with you. They are
Yeah.
dancing with you. This is the most memorable moment. And in every celebration, I am surprised for something like that. Yeah, it is very memorable. It is very. We are very, very, very happy with them. Mm-hmm.
Yeah, it is privilege.
Yes,
really.
yes, it's a really privilege. Mm-hmm.
Okay, Assistant Professor Dr. Ebru Soy, thank you very, very much for being with us. We really appreciate your time and your devotion to patients. Thank you very much.
It's very great to be. It was very great to be here, to meet with you, to know you. Thank you for giving me this chance. Hope to see you.
Thank you, Doctor. Hope to see you soon, very soon. Thank you very much.
Okay. Bye.
Thank you.
For more information about healthcare in Turkey or the services International Health Tourism Association provide for international patients, please reach us from aidtoday.org. I am Idil Saguner, and you've been watching Aid Today Live, brought to you by International Health Tourism Association. Thank you. Good night.
Good night.
Bye-bye.
Turkey today is uniquely positioned to offer excellent medical value to patients from every corner of the globe. The concept of medical tourism in Turkey blends the country's worldwide reputation for high-quality physicians, advanced surgical treatments, precise diagnostics, attractive pricing, luxurious 5-star hospitals, quick response time and beautiful holidays. Turkey's academic and teaching institutions are universally recognized for their high levels of achievement and for the exemplary training of its doctors. Turkish doctors evidence high visibility in the international arena, as lecturers at medical schools and hospitals, as visiting experts or presenting papers at international conferences. Turkey is distinguished by institutions of research and higher learning that have achieved global acclaim. Researchers in these laboratories have developed many inventions to help fight diseases and illnesses. The use of modern technologies, techniques and devices minimizes both the duration of the surgery and the recovery period, adding to the patient's quality of life. Turkey has an expanding network of ultra-modern hospitals and medical centers that are either privately financed or state-owned. Well-staffed and fully equipped, these facilities are highly efficient and among the most advanced in the world. They have the capabilities to respond to the complex needs of modern medicine, from initial diagnosis, hospitalization, post-operative intensive care and physiotherapy, through to patient rehabilitation. Turkey offers world-class medical professionals and healthcare solutions for less than any comparable environment with almost no waiting time. Turkey's medical expertise and institutions provides excellent healthcare cost value with up to 60% price advantage compared to those of the USA and Europe. Patients doesn't have to compromise on price or quality, they can get both in Turkey. Hosting over 1 million visitors for medical tourism in 2019, Turkey possesses a plethora of qualities and inherent advantages and ranks among the top 10 source countries in medical and health tourism. Setting out plan to become major global medical tourism hub in 2020, Turkey's ultimate aim is to promote innovation and ensure international patient access to highest quality treatment.